we have this CBCT open of one patient. Recording chalu na? So we have to plan an implant in this patient, or we have to see a particular tooth which requires endo or requires extraction. So how we see the CBCT? First we need to understand. Firstly, now we'll click on this small spot and it will enlarge one of the views. So let me talk about the views. This is a full 3D view, which is very good for explaining to the patient, orienting them to the software, to the machine, to the technology which we are having, that this kind of a technology is not available in a 2D view, in an X-ray. This is only available in CBCT. Then we have this reconstructed OPG image, which is basically like a 2D X-ray, but it has been reconstructed from the 3D slices. So this is not as accurate for diagnosis as our 2D image. Not as accurate. In the this OPG is not accurate. The OPG, actual OPG is more accurate. But when we are having, we need some orientation. So we have this image. Then in one of this, we have these three sections. So these three sections are the main sections which we get only in a CT scan. We don't get these in a 2D image. So we will concentrate our discussion on these. Yeah. So let me come to the right side here. This I will enlarge. This is an axial image. Axial means the section has been cut vertically from head to toe. Okay. So we have cut the mandible like this and we are watching it from the top. So what we are seeing actually, we are seeing this image from here. So we are going here inside or here outside. So we are seeing it from the top. We have cut it and then we are seeing it from the top. So this is the axial. Let us orient ourselves to this axial image. You can see this is the, firstly you can understand this is the mandible. How we can understand this mandible? It does not show any hard palate. And it has long extensions of the bone which are the ramus area. Then we have the teeth. Now if we go from start going from down to up in the mandible, so we go most inferior border of the mandible is like this, and this is the hyoid bone. Then we are going little more up, so we are starting from the base and we are moving up. So first what you will see when you are moving up, firstly you will see the bone which is the base of the mandible. This is the anterior region, this is the posterior region. Now you slowly start to see the root apices at one of the sections. So see, you see the root apices. Now you go up, little more up, little more up. You can see more of the tooth. Now this is the point of the CEJ of the tooth, where you are able to see all the orifices properly. Apices was the base and orifice is the cornal portion. This is the CEJ. Now you start to appreciate the enamel border. Can you see this? This was not present in the lower slices. See, here it is not present. But when you come little more, you can see more whitish area. This is the GP. Then you move up, so you see the crown portion. So this is the crown portion. So here what we can see, this is mainly for the understanding the buccal and lingual width of the bone. Okay. So this is the lingual side, buccolingual width. And also it is very good view to understand any fractures or majorly understanding any extra orifices, finding MB2. This is the view which we need to use. Okay? Then we move on to the, this is the sagittal view and this is coronal view. Yeah. Okay. So sagittal view is what? It is, we are slicing the head from the middle. So we are cutting it up and then we are moving from the sideways inside. Okay. So this is the sagittal view. Yeah. Middle to lateral. So first what we see here, this is the upper bone, this is the lower jaw. In this we will able to see what we see in the 2D X-ray. This is the sagittal view, is the view which we actually see in IOP. Yeah. So sagittal view mein we are seeing here the sinus. Yeah. Then we can see the roots of the teeth. Now what we are doing here, we are just going more sideways. Either we are coming in the front or the back. So here we will be able to appreciate the lateral wall of the nose. So this view is very important. If we are seeing the lateral wall of the nose, this view is very important to plan the angulation of the implant in the anterior region. Posterior mein to we will not be able to plan much, but here we are cutting it through and through, so we are able to plan the implant here. So this angle we will get, okay? Because we are going to see the nose, we are going to see the nasal floor, we are going to see the palate area, okay? And if you look closely and if we change the densities, we'll also be able to see the tongue position, and we also able to understand the nasopharynx. This is the soft palate. Huh? So this, and this is the hyoid. Okay. Yeah. So for anterior region, if we want to plan the implant, we will plan it in the sagittal section. Now we also have the option of the coronal plane. So coronal plane is basically we are cutting it from the middle like this. So like this we are cutting and we are going behind. Okay. So sagittal plane was in the middle. Coronal plane is we are cutting it from the front and going back. So this is more important for posterior implant. Okay.
It will tell the height.
So this is important, and mesodistal also. This is also one view which we cannot get from the IOP at the posterior, because we cannot understand the mesodistal dimension. So here we are going to plan this. So this is our what we are planning now is region of 1 to 4. So first we orient ourselves in the OPG image. This yellow line is the coronal plane. So we will go into the premolar, this area which is the empty space. Then we enlarge this, so we get this dimension of the bone. This is just the canine. This is the canine. We are going little behind and we get this empty space which is the premolar. Now here if we want to plan, first of all we should understand whether our orientation of the axial plane is proper. So this line which you see in the middle now, it should pass from the posterior border of the mandible, touch all the roots, touch all the teeth and come back to the other side. Okay, if this is a problem, we can change it by clicking on it like this. So every dot we can change. So now I am going into the maxilla, and we will see for the maxilla, see this. For the maxilla this is good, but if I want to plan pterygoid implant, I will not be able to do, because this line is going away from the pterygoid. The pterygoid is more medially positioned. So in the maxilla, if I want to plan a pterygoid implant, I have to move it like this. So this is the most important thing that everybody misses in a CBCT planning for the implant. So for maxilla, you have to change this plan, change this drawing a little bit, so that you can actually see the pterygoid. Because the pterygoid plate is situated more medial to the palatine process, more medial to the maxilla. So now I will be able to see the pterygoid if I want to do it. See this. Previously in the OPG this was not visible. Now this pterygoid is visible if I want to plan for it. Now we are planning for the 2-4. For the 2-4, first see, we have the bone available here. We go on to the right side panel. We go down. We have one measurements. So we first take the measurement of. You click once. You select one point. Go to the end of the anatomic landmark. So if it is nerve, you go till the nerve. If it is sinus, you go till the sinus. You see the available bone width, which is 24 mm. But we have to stay away from the anatomic landmark by around 1.5 to 2 mm. So if it's a nerve, we'll subtract 2 mm from this. But if it's a sinus, we don't need to subtract, because we can go till the sinus. Okay? If it's a nasal cortex, we know. So 24 mm is a huge bone in this case. Now we see the width also. Same thing I am selecting. I am not changing anything. Same thing I select. And from the outer cortex, firstly on the crestal part, one outer cortex to the other. Then again I will select. Then on little bit on the middle third, and then on the cervical third of my planned implant position, I will take the width. So here I am getting 8.3, 10.4, 12. So I will select the lowest figure first. So I have minimum 8.3 mm. And if I want to plan an implant, I also need, what I got here is buccolingual width, I got the height, But one thing I have not got is the mesodistal width. Where we will get the mesodistal width from? We will only get it from the sagittal view. We will only get it from the sagittal view. We will not get it from the occlusal view. Only sagittal view is the one which will give us the mesodistal. Okay? So in the sagittal view, this sagittal view, what we get? We just want to make this. Okay? So what we see here, canine and second premolar. So we will take our measurement and we will take from the crest only, from the canine to the premolar. Also, if the roots are convergent, then we take it also in the root apices from here to here. If they are convergent, here they are not convergent. So here we are getting 8.3. Okay. So how we can plan the implant? We have to first see what is the mesodistal bone width, the distance between the two teeth, and what is the buccolingual width. Select the number which is smaller. So if its buccolingual width is coming 8.3, here also it is coming 8.3, but imagine if it was 7, I would have selected 7. And from there I would subtract 3 mm. Because we need 1.5 mm from each tooth, 1.5 from this side, 1.5 from this side. So we get 3. So 7 minus 3 is 4. So that's how we decide implant diameter to be 4. Okay. We always select the lower number from the two scans, lowest number. And then we also have 24 mm. But we don't need to place 24 mm. We can go by 4 mm. Or let's say in Norris we have 4.2. So we can go by 4.2 by 10 or anything, or 13 or 16, whatever we have. Okay, so we can actually plan the implant here. We'll go to the left side. We will put our measurement, let's say 4 by 13. Okay, we select this 4 by 13. So 4013 is 4 by 13. Select this implant. Now you will get this blue shadow. You place it here anywhere, and then you can rotate it. Okay. Okay. Now you place it at the crest. Now you understand. Firstly, you have understood that we have to place it in middle of the buccal and the lingual, or more so towards the palatal. Better more so towards the palatal. Okay. But now we also have a measurement to check the angle. So we select the angulation tool. Click on the long axis of the implant. Second click and third click will be at the 90 degree. Here we get this. Fix it like that. You have this, and then we have this. So
occlusal plane से किस degree में?
Okay. So if we were to go straight, we would come out from the buccal, right? So how much angle we have to make our implant handpiece or drill is 149 का उल्टा, मतलब it is 30 degrees. 180 होता है ना total. तो 180 minus 150 is 30. तो we have to make it 30 degrees. तो ऐसे जाना है, तो सीधा तो नहीं जा सकते, बोर्ड है ही नहीं इधर, तो we have to tilt. So how much tilt we have to do is this is what this is telling us. So this we can approximately make 30 degree. Now we understand we will need an angulated abutment to do this case. Prosthetically, if we want to restore in a proper thing, we'll have to do an angulated abutment. Yeah. Or if you want to avoid angulated abutment, we can do multi-unit. Angulated abutment we can do only symmetry. Okay. You got this? How we have planned? इसमें भी एक ये थोड़ा पीछे कर लेते हैं. So we can plan in all three dimensions. Open up every page, open up every view, and you can change the implant direction, and you can plan. See, in the OPG previously it was slightly this way, so I have made it slightly this. So now in this also I understand I don't have to be completely straight when I'm drilling. I have to position my drill slightly distally, and this head should come easily, because otherwise I would hit the canine. So I have to slightly. So in this way it gives me an orientation. Now I can go on to this also, and I can see. In this also, what I can do is I can reduce the density of the bone and I can actually see the implant, how it is in comparison to the rest of the teeth. Can you see now it is coming out?
Yes.
Can you see in the axial it is coming out? So that's why I told it will require a 30-degree alignment. We can't play without, we have to position it according to the bone. Okay? Or the future tooth which is there. So here we have enough.
So implants we have to place according to the bone that is there, and then we choose the abutments.
No.
Most of that prosthetically होना चाहिए, but we would not, like, see, we have a lot of bone here and we have good intra space. See, we have a lot of bone, we have good intra space. So what we can do, we can इसको हटा देते हैं. So what we can do, we can make this little straighter, this more palatal. Okay. ठीक
Straight
है.
abutment
So
में
now we can do it with the straight abutment. इधर है, but नहीं रहता, तो क्या करते हैं? So do we
Because
want
we
to
have a
really?
good width.
हाँ, but if width was not there
Yeah.
and the bone was tilted, would I really want to make a straight implant just because I want to put a straight abutment and GBR? No, I would not do a GBR there. Unnecessary, na? The bone is there, but it is not in our favorable angle. What we can do, we can choose a longer implant if the space is there, and we can choose a 30-degree abutment. That's also correct. It's not wrong to do a 30-degree angular abutment. Yeah. Cool.
So for her,